How to spot signs of club drug abuse. Club or designer drugs are drugs that are made synthetically in labs. They are commonly found at clubs, bars, parties, and raves, and abused often by teens and young adults. Club drugs include MDMA, Ecstasy, Molly, Rohypnol, Roofies, ketamine, Special K or Kit Kat, GHB, bath salts, and synthetic cannabinoids, Spice or K2. Since there are a variety of club drugs, there are many symptoms a person may exhibit while on them. The side effects can be serious and even life-threatening, so early recognition and intervention is critical. Learn how to spot club drug abuse so you can tell if someone you know has a problem. Method 1. Watching for general symptoms. 1. Check for coordination problems. A person who is on club drugs may have coordination problems. They may have difficulty walking or walk in an awkward way. Their muscles may cramp up and cause them to be unable to move the correct way. The person may be dizzy or faint. They may clench their teeth or jaw. 2. Look for tremors. Club drugs cause many negative side effects, such as shaking or tremors. The person may appear to be chilled, or they may actually be sweating. When you touch their skin, they may be clammy or damp. They may be shaking like they're freezing, but their skin may be wet or covered in sweat. Notice if their hands or limbs are shaking as they do daily tasks. Watch for sweating or damp skin when they haven't been in the heat or doing physical activity. 3. Identify unusual pupils. Many club drugs dilate the user's pupils to an unusually large size, including methamphetamine, LSD, and GHB. Constricted pinpoint pupils, even in dimly lit rooms, are often an effect of heroin or other opioids, but these drugs are less common in party scenes. 4. Monitor for behavioral changes. Different club drugs affect people in different ways. On ecstasy, the most common club drug, or other stimulants, a person may have extremely high energy levels. On sedatives, such as Rohypnol, the person may have no energy or lose consciousness completely. Many drugs can cause aggressive or combative behavior, or hallucinations that cause the user to react with fear or euphoria to non-existent stimuli. All the drugs affect the brain, but in different ways. Any significant change in someone you know should raise a red flag that drug use might be causing the change. 5. Look for any signs of paranoia. Some club drugs, such as ecstasy or meth, can cause paranoia. Those who are using club drugs may think there is a threat or be more apprehensive than normal. They may even have hallucinations, act like they are in a dream, or feel disconnected from reality. The person may also have delusions or act in a delusional manner. 6. Notice a lack of inhibitions. Club drugs lower people's inhibitions. Often, they feel good due to the drugs and end up engaging in reckless behavior. This may be driving or doing other dangerous things while under the influence, or participating in risky sexual acts. Because of drugs, people may make poor judgments, which may lead to injury. 7. Check for excitability. Many club drugs are stimulants, so they make people stay up all night so they can dance and party. A person appears to be having a great time and is super excitable. They may act hyper or do things in an abnormally fast or hyperactive way. This may include sporadic movements or talking very fast. 8. Look for cognitive problems. People who use club drugs may not make a lot of sense if you talk to them. Their speech may be slurred, or they may speak in sentences that don't make any sense. The person may say things they don't remember saying. They may do things while under the influence that they don't remember, or may lose consciousness completely. 9. Notice any signs of depression. Depression is another common symptom of drug addiction. They may become extremely depressed after coming down from the high of the club drug. They may become irritable or withdraw from family and friends. They may have problems sleeping, such as insomnia. 10. Identify signs of past drug use. Many drugs can cause long-term mood or behavioral changes even after the drug has left the system, especially for frequent users. Even if you only see someone while they are sober, you may notice major mood changes, paranoid episodes, or difficulty functioning. See below for specific information on the effects of common club drugs. Method 2. Recognizing signs of addiction. 1. Determine if the person is neglecting responsibilities. A drug abuse problem may result in problems with a person's responsibilities. They may stop going to work, skip classes, or cancel plans with friends. Instead, they go to clubs or parties where they can get more club drugs or take them freely. For example, the person may skip class or not come to work because they were out the night before at a club or party doing drugs. 2. Notice if they've stopped doing other activities. A person who is addicted to drugs may give up activities that are not related to the drug use. They may stop doing things they used to do often, drop out of clubs or groups, or cancel social engagements. For example, a person may stop participating in a sports team or neglect going to the gym due to their club drug use. A person may stop playing the piano or quit their band. 3. Recognize personality changes. A club drug addiction will lead to changes in personality. The person may start acting erratic, jittery, or over-excitable, or have mood swings. The person may also act like they are confused. Often, a club drug addict will stop caring for themselves and have worse hygiene. 4. Watch for destructive behavior. As with any drug addiction, a person who is addicted to club drugs may start to participate in destructive behavior. They may stop going to school or work, or their work at either will get worse. They may start borrowing money and not paying it back, or they may resort to stealing. Day-to-day self-care such as hygiene and regular sleep may fall by the wayside. A person addicted to club drugs may participate in risky, unsafe sexual behaviors, like having unprotected sex with multiple partners. 5. Watch for poor health. If someone is abusing club drugs, their health will start to decline. They may experience significant weight loss or weight gain. They may start to have sinus problems or nosebleeds. They may also have red eyes or burst capillaries in their eyes. The person may say that they are sick or carry around eye drops. 6. Look for physical withdrawal signs. Many club drugs can cause dependency in frequent users. When off the drug for long enough, these users experience physical withdrawal symptoms. GHB withdrawal, for example, can cause insomnia, anxiety, tremors, and sweating. Overcoming an addiction alone is very difficult. If it turns out someone you know is trying to stop drug use, recommend professional help from a doctor or therapist. 7. Check for drug paraphernalia. Club drugs can be smoked, taken as pills, injected, or snorted. They may come in powder, crystal, or pill form and may be able to be smoked inside a cigarette or pipe. Some drugs, like Ecstasy, may look like candy and be placed on candy necklaces. Look for baggies, vials, pipes, inhalers, or syringes in the person's room or trash can. 8. Notice any rave or party-related items. Since club drugs are usually taken in very specific places, the person may have certain items that point to club drug usage, or participation in situations or activities that lead to club drug usage. For example, you may look for surgical masks, glow sticks, pacifiers, lollipops, bags of candy, or candy jewelry. 9. Know who is at risk. Club drugs are mostly used at clubs, raves, parties, and bars, so people who frequent those scenes are at a higher risk for club drug addiction than people who do not go to those places. Due to the places where most club drugs are found, those who use and get addicted are often teens and young adults. Drug use is higher among people who attend these events, but not universal. As a rough estimate, about 1/3 to 1/2 of attendees have taken club drugs at some point in their lives. Method 3. Identifying specific drug use. 1. Learn about MDMA. Usually called Ecstasy or Molly, this is the most popular club drug in most areas. Short-term symptoms, 3 to 6 hours. A boost to energy, mood, empathy, and sexual arousal, increased heart rate, sometimes nausea, muscle cramping, chills, or sweating. Medium-term, up to 1 week after coming down from ecstasy, users are often anxious, irritable, spacey, or sad. They may have trouble sleeping and lose interest in food or sex. Long-term, it is not known how addictive MDMA is, but some users start taking it multiple times a week to prevent the medium-term symptoms above. Additional info: user may show additional symptoms since MDMA is often combined with other drugs. 2. Identify LSD use. Also called acid, LSD is still one of the most common club drugs in use today. Short-term symptoms, up to 12 hours, distorted perception and rapid emotional changes, causes irrational behavior and makes coherent thought difficult. Can cause rapid heartbeat, sweating, tremors, enlarged pupils, or dizziness. Long-term, some frequent users continue to experience disorganized thinking or other lingering effects even while off the drug. Some experience flashbacks, re-experiencing some aspects of the drug use. 3. Find the symptoms of methamphetamine abuse. Meth is extremely addictive and dangerous, rapidly causing behavioral and physical changes. Short-term symptoms, up to 12 hours. Increased, unpredictable activity, faster breathing and a faster, irregular heartbeat. They may experience tremors, dilated pupils, increased sweat, or many other physical symptoms. Medium-term, binge users may stay high for 3 to 15 days at a time with little to no food or sleep. They are hyperactive throughout, but become more unpredictable and potentially violent toward the end. This is followed by up to 3 days of sleep. Long-term, addicts can develop many obvious physical signs, such as sores, poor hygiene, an unhealthy pale complexion, and damaged teeth. 4. Learn the signs of Rohypnol abuse. Rohypnol or roofies are well known as a date rape drug, but they are also taken intentionally. Since it is a sedative, its effects are significantly different from those of the stimulants and hallucinogens listed above. Short-term, a few hours. Drowsiness, muscle relaxation, impaired motor function and mental abilities, confusion, aggression, or slurred speech. Amnesia and dizziness can last up to 12 hours. Long-term effects are unknown. Warnings. Sedative club drugs can be deadly if mixed with alcohol or other depressant drugs. Stimulant club drugs can lead to severe harm or death by causing dangerous heart arrhythmia or electrolyte abnormalities.